have the opportunity to have some labs and learn. We try to use this space as much as we can when we have you here on campus before you go out into your supervised practice and you're in the online classes. So, yeah. Do you have any other questions? When you think about it, you know, a way to justify expansion of educational requirement from bachelor's to master's, you have to also kind of think about expanding scope of practice. How are you going to justify that additional salary that you want? You know, what additional duties can you perform? And so I think being able to get nutrition to a patient more quickly is one good example. Even outside of the hospital setting, at residential living facilities, long-term care, oftentimes there's nobody on site who is able to place a feeding tube. So if a patient gets pulled or for whatever reason it needs to be replaced, they often have to wait or even ship the patient out to a hospital setting and then bring them back. And so if you had a dietitian who was able to place with a system like CoreTrack, I think it would save time, money, and possibly, you know, reduce malnutrition risk and all that other things of not having food for a period of time. So that's where we're going. Yeah.
So since we're referring to enteral, what about parenteral nutrition? Is that something that you're directly involved with as well?
Yep. We teach writing TPN prescriptions in the advanced MNT courses. You know, you'll probably be able to work on writing those prescriptions, and then it'll be checked by your preceptor when you're at your site. You'll usually go through a critical care rotation where you're writing TPN. And then if that's something that you're really interested in, and you might want to go on and get your CNSC, then, you know, you just let Professor Baird know, and she'll place you in more of those types of settings. She herself is a CNSC, and she really loves critical care, so she'll know exactly where to put you if you want to work with TPN. As far as order writing privileges, that's something that I hope will be coming for dietitians more widely. As of now, dietitians often write the TPN prescription, but then it actually has to get ordered by the physician. So hopefully with increased education requirements and licensing, we'll be able to do that too. Any other questions? And if you don't want to place feeding tubes, it's not saying that you're going to have to for sure. This is still something where I think you'd have to be in a clinical setting, you know, working with pretty ill patients, and also want to be trained and have that in your privileges that would be given by the organization that you're working for. But it's another opportunity if it is something that you're interested in. Yeah.
Are you able to, like, outside of class time, come practice? Like,
Yeah.
Okay.
Yeah, if you just arrange it with the instructor and we make sure the simulation center knows what we need. So this is kind of the old school placement, and then hopefully by the time your class would start, we'll be using that guided enteral nutrition placement system too. Yeah. So that's the simulation center, basically. The mannequins. We have lab in this room. We also set up stations for biochemical assessment, so you can do finger pricks to test for blood glucose and hemoglobin, just to get that kind of exposure and lead. Mixing thickened liquids. We did that with the SLP students, so that was really neat to see just their perspective on dysphagia and, you know, their priorities when treating a patient with dysphagia versus the dietetic students, and they got to have a conversation. That was interesting about that. So, yeah. Anything else I didn't mention or they had a question about? Okay, well, we can head back downstairs then. And then if you have any other questions that you want to ask Dr. Vogelfang about,